Asthma can be tricky. It affects children's breathing and can change from day to day. That's why doctors keep a close eye on it. Monitoring asthma helps us understand how well the child is doing. It also helps us make sure they have the right treatment plan. With careful monitoring, we can help kids with asthma live full and active lives. Asthma is like a puzzle, and sometimes the pieces don't all fit together in an obvious way. A child might have wheezing one day but be completely fine the next. This is why doctors use different ways to check on their asthma. It's like putting together a puzzle, using all the pieces to see the full picture. By monitoring asthma, doctors can adjust the child's treatment plan as needed. If a child's asthma is well controlled, they might need less medicine. If their asthma is not well controlled, they might need different or stronger medicine. Monitoring helps us find the best way to manage each child's asthma. Doctors have special tools to help them monitor asthma in children. One of the most important tools is simply listening to the child breathe. Doctors use a stethoscope to listen for any wheezing, coughing, or shortness of breath. They might ask the child about their symptoms too. Another important tool is called a spirometer. This is a simple device that measures how much air a child can breathe in and out. It helps doctors see how well the child's lungs are working. The spirometer can show if the airways are narrowed, which is a common problem with asthma. Doctors also look for signs of inflammation in the airways. Inflammation is swelling and irritation that can make asthma worse. Sometimes doctors use a simple test called a FeNO test. This test measures the amount of nitric oxide in the child's breath. High levels of nitric oxide can mean there's inflammation in the airways. Monitoring asthma isn't just a job for doctors, it's a team effort. Families play a vital role in helping doctors understand how their child is doing. Parents and caregivers spend the most time with their children, so they are the experts on their child's usual behavior and any changes they notice. Doctors rely on families to share important information about their child's asthma. They'll want to know how often the child is using their reliever inhaler. They might also ask about any triggers that seem to make the child's asthma worse. These triggers could be anything from pollen and dust to exercise and stress. By working together, families and doctors can make sure that children with asthma are getting the best possible care. Why is good asthma monitoring so important? Because it helps children with asthma live healthier and happier lives. When asthma is well managed, children can run, play, and go to school just like their friends. They don't have to miss out on all the fun. Good monitoring helps doctors spot problems early on before they become serious. It also helps them adjust treatment plans to make sure they are always working as well as possible. This means fewer asthma flare-ups, fewer trips to the hospital, and a better quality of life for children with asthma. Remember, asthma is a journey, not a destination. With careful monitoring and a strong partnership between families and doctors, children with asthma can breathe easy and live life to the fullest.